Good afternoon. This question is for the Premier. I'm going to try to follow my colleague Chris Epp on this question. Premier, I'm gobsmacked again. Do you realize what kind of a message this sends when essentially you're paying people who have held out from getting the shot and who you insist today strenuously are the biggest part of the problem, are the problem right now, and that you're actually giving them something? Do you realize what kind of a message this is going to send to the 7 out of 10 Albertans who have gone out and got fully immunized or not?
Rick, I wish we didn't have to do this, but this is not a time for moral judgments. This is a time to get people vaccinated. We have done everything we can, left no stone unturned, made it as easy as possible. We're the first province out there with the big lottery. We've had a bus running around the province. We're the only province with a billing code that allows doctors to bill for proactively calling their patients who are unvaccinated to share medical information with them. We have left no stone unturned, and yet we have the lowest vaccination rate in Canada. We are about 5 percentage points below the Canadian average, and that is why we're getting hit harder. And if the choice is between a sustained crisis in our hospitals, or God forbid, widespread restrictions, which I want to avoid at all costs, or finding some way to get the attention of those vaccine latecomers, we're going to choose the latter. We're the only province to do it. It's worked in some of the U.S. states. I wish it didn't have to come to this. But I'm much more concerned about protecting our hospitals than I am about the message, some abstract message that this sends. The message it sends is a very simple message. If you've been holding out and you just haven't gotten around to it, it's now literally worth your while. Now, let me add one other piece to this, Rick. We do know in research around most of the world, we don't have this specifically in Alberta, but if we're at all similar to research across in other parts of Canada, the U.S., Europe, we do know that vaccination rates amongst people in lower income groups tends to be higher. And so this financial support may remove some of the barriers. Imagine that you might be a very low income person who living in a remote area who can't afford the gas to drive into town to get the shot. This will help. This will cover you. Maybe you're a very low income person who can't afford a taxi to go to the local pharmacy, what have you, and you've had trouble, you're not aware of the free ride shares that we're offering. This will give you that little bit of help. So I think this may also help to reduce barriers for some of the folks who might be facing barriers because of lower income status, and that might help them a little bit as well.
Can I chime in with a supplemental now?
For sure, for sure.
Yes. So let me get this straight. 8 o'clock in the morning tomorrow in indoor public spaces, the fully vaccinated, everybody, including the fully vaccinated, will put their masks back on. But you aren't, and I'm not saying you should do this, I'm saying why didn't you do this? But you're not restricting access to non-essential settings for like bars and restaurants for those people who are not fully vaccinated. An idea that pollsters say is favored by many Albertans, and an idea that other conservative governments have done. So perhaps you could explain how you kind of square this circle, that the fully vaccinated tomorrow will have more restrictions on them than they have today, but the unvaccinated will emerge today with $100 more. So
well,
I just don't understand how A equals B.
They only emerge with $100 more if they do the right thing and get the jab, protect us, and get this thing under control. And so we're going to try everything we can. And this is the next step. We tried the lotteries. We saw an uptick. It helped a bit. And we're going to try this. And we don't know if it'll work or not. But I'll tell you this, Rick, if we can get 5 extra percentage points of the adult population to step up with this small financial incentive, this $100 card, that'll cost us around $20 million. That's real money. But that is a fraction of the cost of what it would to taxpayers to hospitalize many of them. Will be a huge cost savings relative to the hospitalization of many of those folks who might now get vaccinated. So this is actually a money saver for taxpayers. We are sure of that based on the experience we've seen in U.S. states that have done this. And in terms of restricting access to places, many in the private sector are already doing that. I'm going to the Labor Day Classic at McMahon Stadium on Monday, and the Stamps, like the other CFL teams, are requiring proof of vaccination. We are providing more convenient proof of vaccination documents. We're also doing the policy work to make it possible for people, if they want, to get a QR code on that proof of vaccination so it's machine readable. So in the future, we can avoid slow-moving long lineups at events like that, and also to help Albertans who want to travel to other provinces that have vaccine restriction policies. So we are trying to facilitate people's choices if they're going into venues that are that don't permit unvaccinated individuals. But we're going to give everything a shot here. And if we can get a few more percent to step forward because of this incentive, particularly perhaps some of the lower income people who for various reasons have barriers, then I think it'll be worth it and it'll save us a lot of money in the long run.